our first call to the public. Is there anyone here who would like to address this committee?
If I can just make an announcement, there was an invitation sent out. Pleasant View will be having an open house on September 20th from 4 to 7 p.m. We'll be highlighting our in-house dialysis services that we'll be offering soon. But we'll also be highlighting all of our services that we offer at Pleasant View. We encourage everyone to come out and see what we have to offer. And if that time doesn't work and you want to learn more, please reach out and we'll set something up for you.
Okay.
Thank you.
Thank you very much. Anybody else? All right, we will move to our agenda items then. Item A, I entertain a motion to approve the contract as presented from LACASA or La Casa in an amount not to exceed $54,040 to be paid from the Child Care Fund and authorize the board chair to execute the agreement.
So moved.
I'll support that. I think we're going to have more information on this tomorrow night. It's an annual renewal for services provided. It's a combination, isn't it, of DHS, state, and us, and
Yeah, it's a combination.
court, family court.
And I know Sarah has a lot to do with the Child Care Fund. If she has any comments to make in the absence of it.
I really don't, I'm sorry. I could try to answer any questions you might have. I mean, it's a great program. It's about all people. Say, I know it's been long-standing and it does great work. I don't have any specifics.
She'll be here tomorrow, Allison, to speak to you about the specifics of it. But we've been a member for a long, long time.
As long as that, 6 years, more, way more. All right, any discussion, questions? All in favor of moving this to Wednesday, please say aye. Aye. Any opposed? And then moving on to item B, I entertain a motion to approve the CPLR grant with the Michigan Department of Health and Human Services for child and parent legal representation and authorize the chair to execute the same.
So moved.
I support that. Motion and support. Discussion. Is there input on this one?
So just very briefly, if we spend $100,000, the state on attorney fees for court-appointed attorneys, we will get reimbursed $25,000, and it's proportional up to $100,000. If it's more than $100,000, it's a diminishing rate of return, but it's a reimbursable grant for a quarter of our expenses up to $100,000. This is something that we do regularly for court-appointed attorneys.
So is this for juvenile offenders or for child abuse and neglect?
It is, the lion's share is child abuse and neglect. That is the bulk of what we do our attorneys. We don't have a ton of requests for attorneys on the delinquency side, but we do have some, and it does, but this only covers, this only covers abuse and neglect.
Okay.
This match, and it actually only covers abuse and neglect where the children are removed from the home. So it's a very specific thing, but we do appoint attorneys for all of those things.
Okay.
How much do we expend? Let's say over the last year, what did we expend?
And it does vary. Our budget is at $100,000. We come pretty close to that.
That generally does cover.
Yeah, we haven't exceeded $100,000. What the problem is, I'll tell you, is that there's been some changes recently. So appeals cost us a lot of money. If anybody appeals abuse and neglect cases, but there's been a real change that we're starting to see trickle down. Where the Court of Appeals came down with a decision that said that attorneys have to jump through a whole lot more hoops right now in order to not be appealable, if you will, with regard to abuse and neglect cases and what they have to do. Getting expert witnesses, and so it's driving up our numbers, but we're still staying within that $100,000 so far, and it's $125,000 with the extra. But what it started at about 4 years ago, I say it started, and the real thrust was an understanding that the counties were really underpaying these attorneys. And so you had to say, how are you going to improve representation for these families if we give you this extra money? And you had to pick sort of criteria. So what I did, which was in response to the court appointments, I raised the hourly rate immediately. We still don't pay nearly what they get in the private sector, but we raised that, and we also now pay for them to attend child welfare trainings to make sure that they're up on all the
what's an approximate hourly rate?
Oh, our hourly rate currently is in court, we pay $100 an hour, and out of court, which would be their preparation or meetings, is $80 an hour. Does that sound like a lot or not a lot?
That's kind
I didn't know.
Not
if you're-
very much.
No, it's very low. I say, I hope you didn't think it sounded like a lot, because it's not.
of, no, it sounds like about 20 years ago.
Yeah, and it is. So we're lucky, we have only about 6 attorneys willing to even stay on the list because we still just don't pay enough. But we do get some of the newer attorneys who are trying to make it, and some of the older attorneys who are trying to get out of it, but they'll still stay on the list. But yeah, it's really hard to it's hard to keep them on the list when, you know, so I try to, you know, do as much as I can for them, and I keep applying for these grants so that I can up it a little bit, so.
Well, that's good. It sounds like not too long ago we heard the thing about the defense lawyers not getting paid enough, so we got on a program that enhanced their pay, and now we got to worry about the prosecutors being reasonably competitive.
Yeah, and we actually have had times where we actually couldn't find an attorney. Like, there's a case that says you will have an attorney present for these children, and we couldn't find one, and it's really like, whoa, what do you do? So I started having to sell my soul a bit. Call our neighbors, you know, and it's not pretty. It hasn't happened too often, so. But that's what this grant helps.
All right. Any other questions or discussion on this agenda item? All in favor of moving this to Wednesday, say aye. Motion carries to Wednesday. And then item C, I would entertain a motion to approve the creation of social work position for family court with a grade 10 for a licensed MSW.
So moved.
I'll support that. I'm assuming that goes to Sarah.
Just a little bit of background though, the child care fund from the state, its reimbursement is going from 50% to 75%, at least for this year. We have a couple of social workers in the county already. If they have a bachelor's degree, they are a grade 7. If they have a master's degree, they are a grade 10. Sarah's request is for an MSW grade 10. Is that correct?
Correct.
That's all the background I have.
Right. Yeah, I know you hear the wording add a position, everybody goes, ooh.
Yeah, that's what I was doing.
I get it. So by raising this, so this is a child care fund, and it's a lot of money, and I had the figures there. The additional reimbursement, our normal budget that we have budget, I'm not asking for any more budget. So within the budget that we already have, which won't go up, the request won't go up, and it won't change, we will have an increase in reimbursement if we spend all that of $149,000. So what I see is that it will be within the budget. It's not going to be the need for anything more. So what this is the state saying, we don't, and I'm sure you guys have all been hearing me say, there's no place to put kids, or we really struggle with that. We're still going to always have those kids that can't be maintained in the community, and we're going to have to find beds for them. The problem is that there's those kids who need to be somewhere, and we've got to have more services, community-based services for them. Where that really right now the problem is the mental health stuff, and this is not news to anybody, I don't think. Mental health crisis for juveniles, huge right now. And CMH is doing what they can, but it's not enough. And it's not any fault of theirs, but it's not enough. And there's just not enough here. We need somebody boots on the ground with our kids who can do a few things. One, we need crisis. We need people who can respond in a crisis. We have kids who have crisis in our office or at the home or whatever, and there's really nobody. All you can do is take them to the emergency room, and then they sit there for 24 hours, and then they say, I feel better now, just to get home. It's just horrible. CNH has a crisis, mobile crisis, but it's very limited, and they don't come out. They more just go on the phone, and it's again, they do what they can, but it's a gap. So we need somebody to be able to guarantee prices. There's also new legislation that's gonna require us to do mental health assessments for every juvenile coming into court. And also, recidivism risk assessments, which I actually am certified to do, and I do them, but to have the court administrator doing it, that's really not best practice. But that's what we do now because we have what we have in the next meeting. But we really need to change that, and so that person would do that. But we also need, we try to find substance abuse groups, and there are many. We try to find anger management. Catholic Charities does what they can, but it's minimal again. We need groups, we need parenting, you know, parent groups are out there hit and miss. But this person we could basically have them do all those things that we are in crisis to do. Instead of having a kid essentially end up at the emergency room, sitting in the emergency room, having parents lose their jobs because they're sitting in the emergency room waiting for a bed that doesn't exist. And that has happened. We've had parents have to sit there with their kid for weeks and months. And that's not that this would avoid that entirely, but if we had somebody who could intervene at the early ages of a crisis, early parts of a crisis, we probably could eliminate a lot of that. And I would anticipate that person would also carry a caseload of counseling, and maybe it's family counseling, which none of these families, there's no family counseling. I mean, it's just, I have to say none. It's, you know, it's
Not enough.
it just doesn't exist. It for practical purposes. So I could talk all day about the need for this position, but the direction from the state when they raised this from 50% to 70%, they even pushed it through to raise it starting October 1. They said the goals of this, basically one of them is increasing the availability and quality of community-based services to meet the needs of youth under supervision. That's exactly what this is.
So I can give a little background on this because I served on the task force, the statewide task force on juvenile justice reform. And that was one of all of that came from that task force recommendation of, there are studies that show that kids who are sent to detention, even factoring out the worst offenders, you expect them to reoffend. But a lot of communities are ended up using like in-house, what's it called? Like overnight, it's not overnight, inpatient
full
detention.
Mm-hmm.
Yeah, full detention. Because there are no services provided in the local community, and so it's either send them to detention or have nothing. And so the work of the task force was to say, how do we help communities develop community-based task force? Because what I started to say was, the studies show that detention actually increases recidivism. That kids are more likely to offend if they've been sent to detention than if they have been treated in community. And so that's what this work was about, was trying to come up with a way to, you can't just tell counties you have to offer more services and then not fund it. So the increase in reimbursement from 50, they first recommended 66%, and we really pushed to say, let's see if we can get the legislature to do 75%, so that it really gives communities more resources to be able to do community-based services. And so that's where this request comes from. The background on that is to try to avoid sending kids into detention. And like Sarah said, even when that is the best prescribed thing, sometimes you can't find a bed. There's a lack of beds, which is another thing we talked about, but have not resolved. But
I can tell stories.
Mhm.
I can tell stories all day long. But just to get so the budget that you look at for my court, like Department 662 is our youth center. And that is the youth center, all the staff down there, everything. 75% reimbursable. I mean, so even though you see our budget is $403,000, I mean, $300,000 of that's coming back. So it's a huge chunk of money that we're getting back from the state, and that's a set amount. Because the youth center, the bulk of it is salary. So that's a guarantee that we're going to put out $400,000, and we're going to guarantee we're going to get $300,000 back. So it's you can't look at our budget and say, oh, you're spending so much money. Because the way the budget goes, that doesn't kind of look. You don't see that money coming back on our budget. You just see what we're spending. It's there. Tracy's got it somewhere, but Tracy might be able to explain that a little better than me. But but we're gonna spend the 403,000, and we're gonna get 300,000 back of that. And that's not including the other stuff, which is another 50,000 above that.
And are you looking at hiring, like, this would be a permanent position? Because you said this is for, at least we know for a year, like the coming
Yeah.
state fiscal year.
I mean,
We don't know if that's gonna be a forever.
if it's in the budget and the years moving forward, I guess it can stay, but when you say permanent position, all of these positions are more or less the same. But if there's not in the budget after this year, it won't be able to continue.
Well, that's why I was just wondering if it's better to do it as a contracting position.
Can I just say, the increase is not being put out as a one-year thing.
Okay.
But that's right, it's being put out as a
Right,
change, that's
Okay.
a change. So
okay,
they haven't changed that
okay.
50%. They've been talking about it for a long, long time, and so I don't anticipate this being a one-year thing.
Okay.
So that's just my sense. I would really rather have it be, we really try to get away from all that contract stuff, I thought. So I'd rather just have it be, but like, same thing, if you have a budget cut, and suddenly I'm back to 50, I'll just make it good.
I mean, that's the determining factor. If for some reason the state does a readjustment, there won't be room in the budget.
No, and then I know that I didn't
Mhm.
have to make it good.
But we hope it's here to stay.
I had a question if I could, sir, if I could take you back to, I understand the need, absolutely, I see it in schools all the time, but to the actual logistics of it.
Yes.
So when you have a person in crisis, this social worker position, they're gonna be available 24/7, they're gonna go to the place in person, because I think CMH does some, like you said, phone.
I did, yeah, they do. They have their mobile crisis, which runs, and I hadn't, it is a little bit more sticky, sending people out by themselves at 3 o'clock in the morning. I don't know that I had anticipated it would be an overnight 24/7 kind of thing.
So what, can you just walk me through like what?
I haven't sorted all that out,
Okay.
but in my mind, Cindy, it's definitely not an overnight thing, just from
Okay.
a safety standpoint. Law enforcement go out, now maybe, like, we're on call, and sometimes in crisis, I'll get on the phone and, we'll talk it through, and maybe that person would be on call. Maybe they go out with law enforcement, I don't know, we haven't really, just at the beginning, because this just came through a few weeks ago, and I knew I had to get it, I haven't thought about that, to be honest.
Would it be such a thing as the child might be held overnight or at the emergency room or something, but the social worker then can
Very, very.
do an early intervention?
Right.
And then there's no requirement that they be Medicaid eligible?
No, that's the great thing about this.
Yeah,
Because
because
that's
it's,
yes.
it's not community mental health, it's Medicaid mental health, so if
And
you
I'm
don't.
glad that you appreciate that challenge, because that's a huge challenge.
Oh, it
Because
it
right now
absolutely
with Private
is.
insurance, and it's better to have Medicaid. I mean, they're getting shut out, and it's terrible. But no, this would be no restriction whatsoever.
Awesome,
The
okay.
only restriction would be they have to see them once a week, as long as they're, because that for childcare fund, you have to see them once a week. But when they've got kids in crisis at this level, we're seeing them every day.
Right.
But that's really the only requirement to comply with the childcare fund.
Thank you.
All right, any more questions? It's good, getting more services for our kids. Okay, all in favor of moving this on to tomorrow night, signify by saying aye. All opposed, and it carries to tomorrow.
Can I just do one other thing, Marlene?
Yes.
I can't be here the next 2 days. I'm
Just
going
one
to
more
train.
night. We're only doing one night now. We just
I
do
can't
this.
hear. I'm going to train tomorrow.
I think we're good. I think we're good.
All right. Thank you.
Thank you. Okay, that brings us to our last call to the public. Anybody want to address this committee? Hearing none, I will declare this meeting adjourned.
Oh, and Caroline, Bill did call me and let me know he couldn't be here, so he's please. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. Thank you. Call to public. Which brings us to our agenda items. I would entertain a motion to approve the grant agreement between the Shiawassee County Health Department and the Michigan Department of Environment, Great Lakes, and Energy for environmental health services in the amount of $112,347 for a period of 10/1/2023 through 9/30/2024.
Make the motion.
Support.
All right, moved and supported.
Just a grant renewal with Eagle for our environmental services that we perform around the county, which are campgrounds, inspections, public swimming pools, water well supplies. And it's a slight increase over last year. So I think it was around 109 last year. It was 109.
All right, all those in favor signify by saying aye. Aye. All those opposed? Larry, while I have you up here, how did the hazardous waste?
Really well, really good. I don't have the final numbers yet, but it was pretty much nonstop, busy all morning. So people love that.
And where was it?
At the collection spot behind VG's,
Okay,
their usual Owasso spot.
okay,
We're good.
thank you. All right, our next agenda item, I would entertain a motion to approve the agreement between Mr. Agbenaya, that's actually not that bad, and the Shiawassee County Health Department for a period of 10/1/23 through 9/30/2024, and authorize the board chair to execute the contract.
So moved.
Support.
Yeah, just a contract renewal with our epidemiologist. It's a part-time contract. He gives us about 20 hours a week. And he does disease investigation, disease surveillance. He works with the nursing homes, he works with the schools, he works on foodborne illness outbreaks. Works really closely with our communicable disease nurse. And it's at the same rate that we paid last year. I believe it's $40 an hour. So we're fortunate to have had him now for, this will be the third year.
Does he do that remotely, or
Yeah.
does he? Okay.
He'll come in once in a while, but majority of his work is remote.
Okay. Anybody else got questions? No? All right, all those in favor signify by saying aye. Aye. All those opposed the same. That motion carries till tomorrow.
I gotta run, I won't be here tomorrow, so. Good to see y'all.
All right, thank you. Anything else for Health and Human Services? If not, we are adjourned. Thank you.